And I'll call our meeting to order at 9 o'clock. Could you do the roll call, please?
Yes, I can. Juliet Ballard. Marta Larson is excused. Marie Gross.
Present, calling from Milan, Michigan.
Margaret Reynolds.
Present, calling in from Pittsfield Township.
Elizabeth Thompson.
Present, calling in from Ypsilanti Township.
Jennifer Green.
Present from City of Ypsilanti.
Phyllis Herzog.
Present from Ann Arbor.
Bruce Astrid.
Present, also from Ann Arbor.
Brenda McKinney. Allison Foreman.
Present, calling in from Ypsilanti Township.
Madden Litton.
Present from Ann Arbor.
And Annie Somerville.
Present, City of Ypsilanti.
Juliet has joined us. If you can capture her, please.
Yes, Juliet Ballard for roll call.
Juliet Ballard, Dexter, Michigan.
Okay. Thank you.
Great. Thanks, everyone. We have someone new on our panel from Chart. Would you guys like to make that introduction and explain next steps?
Yep, I'll take the lead on that. I wanted to introduce Janan. She is my colleague at Chart, and she has taken the lead of the Healthy Aging Collaborative now. So some of you may have heard that I'm working on some other initiatives at Chart. I'm kind of doing a little bit more in the business development space. So less on the project work. So Janan, she's been part of our health and social innovation team for several years now. She's been working on a lot of the social determinants of health initiatives that we've been doing at Chart. And then this year has been part of the WHI, specifically has taken over leading the Healthy Aging Collaborative. So she is going to be the representative of the Healthy Aging Collaborative on the Commission on Aging, and I will be rolling off. So this will be my last meeting as a panelist. Of course, I will be an audience or voyeur at times as well. But I will turn it over to Janan. Maybe she can just briefly say a few things about her and her background, and I'll leave it from there.
Yes, thank you, Dina. Thank you for the kind introduction, and thank you, Marie, and the Commission on Aging for having me today. I have actually been sitting on these meetings for a little while now, so it's been really nice to hear all the progress that you have been making, and we've been reporting back on the Healthy Aging Collaborative. I'm really excited to be in this role. I might have shared with some that I have personal experience with my father and his experience on aging, so as a caretaker most recently, but I've been doing this work for a little while now, or quite some time. I don't know. It's getting to that point where it's getting longer than it is new. But I've worked from healthcare sector to community health to private sector, and I have my master in public health and a project management background. Yeah, and I'm excited to do this. I'm also facilitating our learning network, which is a statewide initiative across Michigan that, as Dina mentioned, works on improving community information exchange statewide and really bringing in important players, which I think will go hand in hand with this work. So really excited to be working with you all, and thank you, Dina, for her help in my transition in, and everybody here who has helped that. Thank you.
Yeah, thank you guys. Thank you, Dina, for all of you have contributed these last many years to the Commission on Aging. And welcome, Janine. You're both welcome to stay on as panelists today if you have questions as we go through. Janine, you've been watching the meetings, but Dina just raises her hand like everybody else for questions and comments, and we encourage you to do the same. All right, up next is public participation. Are there any members from the public who wish to share anything with the commission? Going once, twice, making it linger just a little bit because Chris Brown said that he was going to share something and he might have just stepped away. There he is. Allowed to talk. There you go, Chris. You can unmute.
Thanks, Marie. Can everybody hear me okay?
Yep.
All right. Yeah, I wasn't sure if you wanted me here or at some other later point in the meeting.
No, this is
Thanks for
perfect.
getting me. I really appreciate it. So yeah, you were looking for an update on, where we were with federal and state lack of activity. So kind of where we're at right now is, as far as Washtenaw County goes, we really haven't had any meaningful update from them other than that, just like all of you in this room know, really nothing's moving forward until a director of aging is in place. So no funds are flowing from that direction right now. We did receive an update from AgeWays a couple of days ago, indicating that in the event of a shorter term shutdown, which hopefully this is, that there would be no interruption to funding. This is about the time of year where our contract starts for our home delivered meal funding through the senior nutrition program. It's a little bit delayed this year, but we have every indication that that's moving forward. So I guess really my only update is that, we're kind of finding out things at the same speed as everybody else is.
Great, thank you. We'll take commissioner comments and questions once we close public participation. Any other members of the public wish to raise their hand? No? Once, twice, three times. All right, so we'll close public participation. Any commissioners have response to public participation? No. All right. So, Chris, I have just one question. So, right now it seems like through AgeWays, which contracts with the county, who contracts with you all of that should continue moving forward as usual until there's a final, this is what's in the state budget that was passed in the wee hours. Is that correct?
Yeah, that is what we have been led to believe is the case.
Okay,
Yeah, really,
great.
that's as much as we know.
Great. Thank you. Um, I did receive another comment from the public. She isn't able to be here today because she is traveling. Anna Peckrell is the director of the Dexter Senior Center, and she was wondering if the Commission on Aging had a director of aging services hiring timeline update. Annie, do you know if there is an update on that?
Sorry, I'm trying to unmute. Can you repeat that?
Yeah, there was a question I received from the Dexter Senior Center director asking if there's an update on the hiring of the director of the Office on Aging. Do you have a timeline update?
So I do not have an update. I know that they were finishing up interviews 2 weeks ago,
Mm-hmm.
and I haven't heard anything else. I'm not on the hiring committee, so as soon as I have anything to share, I will let you guys know.
Great. Thank you.
Uh, I can speak to that. I'm on the hiring committee and it
Oh,
is
great.
still in the interview stage.
Still in the first interview stage?
The first interviews have ended. is moving on to the next interview stage.
Great. Thank you, Jennifer. All right, closing public participation and commissioner response. Approval of the August 1st minutes. That should be the September minutes, right, Katie? Yeah, yeah. So what was attached to the email was the September minutes. Do we have a motion for those? Phyllis, a second? Elizabeth, great. Any comments, discussion? Then Katie, if you could do our vote.
Yeah, vote on motion to approve the minutes from September 5th. Juliet Ballard,
Yes.
Marta Larson. Oh, she's excused. Marie Gress,
Yes.
Margaret Reynolds,
I wasn't present, so I'm going to abstain.
okay. Elizabeth Thompson,
Yes.
Jennifer Green,
I abstain as well. I wasn't present.
Phyllis Hertzig,
Yes.
Bruce Astron,
Yes.
Brenda McKinney, not here yet. Allison Foreman,
I wasn't present, so I'm going to abstain.
Maiden Litton,
Yes.
and Annie Somerville.
Yes.
Okay, motion is approved.
Fantastic. Then up next are our discussion items, and first up is a presentation by AgeWays with their 2025 Unmet Needs Survey for Washtenaw County. So I will turn the floor over to Stephanie Carpenter.
Thank you. I have a presentation, so I'm going to share my screen, see if I have, it looks like I have access. There we go. Okay. There we go. I think we're good. Okay. Just move some things around on my screen. Okay, so like Marie said, I'm Stephanie Carpenter. I'm the Director of Planning and Advocacy here at AgeWays. And we recently conducted a needs assessment of our entire region. As a reminder, our region is 6 counties from Monroe to St. Clair. So we have Monroe, Washtenaw, Livingston, Oakland, Macomb, and St. Clair counties, serving close to 30% of the state's older adult population. Some of you might remember in 2019 when we did a similar needs assessment survey. We wanted to conduct that basically the same survey again. We used the same research company, Mitchell Research, to conduct it. They used a variety of platforms. They used this time they used some texting links along with some phone calls as well to try to get enough participants. We received close to 2,000 responses throughout our region, and they were able to extrapolate that out to they were able to get a statistically significant response rates. They were able to extrapolate that out to our entire region. So really the goal of this this unmet needs survey, some of you recall we do these as an area agency on aging. We do these annual implementation plans every year, and then every few years we do these multi-year plans that really outline the different programs we're offering, the advocacy work we're doing, any new programs we're piloting, kind of all of that stuff. So really in that multi-year plan, the state, and this is a state requirement. So they like us to do these needs assessments because really as an area agency on aging, we're supposed to be addressing the needs in our community through our programming. And so we continuously want to assess what those needs are in the community that might be going unmet and how we can, better serve those individuals and address those program needs, or also work with our contracted partners to address those needs, or is what we're doing good and we're kind of addressing those. So really just kind of getting a lay of the land there. And so these needs assessment surveys look a little different depending on the year, depending on our funding available to do them. So luckily enough, we were able to, again, like I mentioned, just basically redo that 2019 survey. This is just focusing on the 2025 results at this point, but we are also compiling all the data from 2019, and we're going to compare it to 2025, see how things have changed. I'm really interested to see, because this is a very kind of pre and post COVID sort of situation. So once we have some of that comparison data, happy to share that as well. The only really change with this survey is that we had more questions related to caregiver needs than we did in 2019. So this survey just specifically focuses on the outcomes in Washtenaw. We do have information for the whole region as well, and there is some things that I point out throughout this presentation on how Washtenaw compares to the rest of our region. And just a note, like I said, we had close to 2,000 respondents in this survey. Washtenaw took up like 16% of those respondents, and the makeup is in line with the amount of older adults in that county of our region. So this is just a basic overview of kind of what the respondents from Washtenaw looked like. So again, most of the a little over 73,000 older adults, 60 and over in Washtenaw. Of those that participated in this survey, the average age was around 70, very in line with the rest of the region. Most of the respondents were married, 45%, with slightly under that 29% being divorced, and then under that 12% being widowed. The education makeup varied. Most had some college, many had a bachelor's degree, and then a good majority had some post-grad and advanced degree, which was actually the highest in our region, unsurprisingly, for Washtenaw, very much in line with the demographics. Most identified living in a suburban area, slightly under that city, and slightly under that rural. Household size, the majority of the people that filled out this survey lived with 2 or more people in their household, but a good portion, 40%, did say that they live alone. 78% have a household income above that $31,175. 47% did say that they can comfortably pay their bills, and a little over half said they had no personal debt, but that means 18% said that they did have over $10,000 in debt. So some insight for this, just Washtenaw County senior population is highly educated, has a significant urban presence. They also have higher proportions of divorced or never married individuals in this compared to the rest of our region. Some services could target, these specific groups who may lack that additional support. We can also leverage some of the educated population's engagement with things like informational resources, and also ensure that there's accessibility across urban, suburban, and rural areas. So some of the most noted concerns have to do with their homes. This is very much in line with what we were seeing in the rest of the region as well. 72% did report that they had no home safety concerns, which is higher than our overall sample in the region, which was 68%. 5% said they did need some major repairs in their home, and 12% needed some minor repairs. 10% said they lacked handrails, grab bars, and 3% said they need a ramp in their home. So some of the main reasons that were identified for not addressing these issues, obviously number one was cost, the inability to pay for these services. Also physical inability, so they can't do any of these things themselves, for example. 10% did also just know procrastination, or just not looking into these and knowing they need to address this, but not really moving forward and how to do that. And these reasons aligned with the overall sample for our entire region. 15% also said they need some additional safety features, things like a walk-in shower, carbon monoxide detector, or some railings. Some insights to take from this section is home repair and safety needs are less pronounced in this region or in this county than in our overall region. So overall, not that there's not anybody that needs these minor and major home repairs, but it is slightly less than the rest of our region. And home modifications are also just essential in addressing those safety needs. So the survey also looked at neighborhood safety and transportation. It asked individuals how safe they feel in where they live. 85% said they feel very safe alone during the day, which is slightly higher than the rest of our region. 13% said they feel somewhat safe, 2% said they feel somewhat unsafe, and actually 0% said they feel very unsafe. And then as far as transportation, 9% they said that they had trouble getting transportation, and 8% said they had missed a medical appointment due to lack of transportation. So the trouble getting transportation and the having missed appointments due to lack of transportation is slightly higher than our overall sample. It was 8 and 7, respectively, for the entire region. 26% of the respondents in Washtenaw said that they do use ride-sharing services like Uber and Lyft, which is actually higher than the rest of the region sample, which was at about 17%. There's some opportunities there to maybe tap into these ride-sharing services, as it seems like the older adults in Washtenaw are more familiar with them and use them at a higher rate than the rest of the older adults in our region. Also, 17% said they have used public transportation, which is higher than the rest of our region, which was at 7% actually. So some insights to gather from this slide. Transportation barriers are more significant in the overall sample for the rest of our region, but the older adults do use ride sharing and public transportation more than in the rest of our region. So there's opportunity there to, help familiarize some more older adults with those transportation solutions. And mobility challenges indicate a need for, again, home modifications, particularly to stairs, to support aging in place. And then also this county has strong neighborhood safety perception, so it reduces the need for things like stronger community safety programs. It seems like they're working pretty well. And then for health concerns and barriers to care, the top concerns outlined in this county were fear of falling, their weight, coping with pain, not able to do things that they enjoy, and then 34% did say that they have no health concerns, which is a pretty good count. As far as pain management, 13% said they experience constant pain, and 19% said they have pain daily. And of those, 53% use prescription or over-the-counter drugs, and 56% said they have made lifestyle changes to manage their pain. 26% said they use ice and heat for that pain management. And some of the identified barriers to care, 21% said they skipped doctor's appointments. 5% said that's because they just couldn't afford that, which was the highest noted reason why. 20% skipped dentist visits. Again, 8% said they couldn't afford. And 12% skipped hearing checks. 3% said they couldn't afford. And also in this region, 24% of the respondents reported excellent excellent mental or emotional health. 33% said very good, 29% said good, 12% said fair, 3% said poor. And that's all of these are actually slightly higher than our overall sample from the rest of the region. Some insights from here: Washtenaw County older adults have better perceived health than the overall sample from the rest of our region, with fewer healthcare access barriers. Dental care remains a concern due to the cost, while hearing care issues are less prevalent in this county. Services could do things like prioritizing fall prevention, weight management, which, as a plug, we do have some programs that do that at AgeWays, so feel free to look into those. And also programs for affordable dental care seem to be could be a unmet need in this county. And also just leveraging the county's strong healthcare infrastructure could be a benefit. And then as for social needs and community connection, some of the top needs in this area identified were 27% lacked physical activity, 31% have concerns over their income, and 20% feel social isolation or loneliness. And of the 32% that want more social contact, some of those barriers are things like financial constraints, mobility issues. Also, 87% said that they have nearby family and friends for help if they need it. And 87% have a confidant for advice. So this is slightly higher than the rest of our region as well. And 32% report insufficient social contact. So, that is a pretty decent decent number. I'm curious to see how that compares to the 2019 numbers when we eventually have those. And that social isolation can be driven by things like financial and transportation barriers, as outlined on the slide. And I just want to make note, just the social isolation piece was actually something that throughout the reports from all of the counties seemed to be fairly high. Again, I'm very curious to see how this relates to the 2019 numbers, but it seems to be an area that a lot of us post-COVID might think, people are back out in the communities and talking and seeing each other again, but it does feel like the social isolation piece is still a strong need in this county as throughout our whole region. So like I mentioned, we added some more questions on caregiving among older adults in this survey compared to the 2019 survey. So 6% of those in Washtenaw reported providing unpaid care, which is higher than our overall sample. The overall sample was at 4%, said they provided unpaid care. And 59% of those said they spend 1 to 5 hours a week caregiving, but 20% of those said they spend over 16 hours a week caregiving. So of those caregivers, 81% said that they feel that they have enough support, but among those that said that they do need more support, they cited other needs as the highest. 17% said they need help finding resources, and 10% said they need things like support groups. So, as we all know, this just outlines how common caregiving is, with an opportunity to help caregivers with resource navigation and help them find the supports that they need. And then for safety and well-being concerns, 91% of those respondents reported no abuse or neglect concerns. 0% reported feeling abused or neglected, and 0% reported that they had items taken without asking. And 1% noted that they are afraid of someone. So overall in this county compared to others, there's low elder abuse concerns, and that suggests good focus on social engagement. But the research firm that did this did want to make note that some of these could be outliers, and it's worth maybe looking into a little bit more. And then service usage and unmet needs. So we asked respondents what services they used in the past year. 86% said that they do use the internet. 59% said they use social media, which is pretty high compared to the rest of our region. 36% said that they use a fitness center. 16% said they utilize a senior center. And 5% said they used no services. And then for some serious challenges that they have, 26% identified walking or climbing stairs as a challenge, 23% identified snow removal, and 19% identified lawn mowing as a serious challenge. So some of the needed services, again, you'll find that a lot of these are very much in line with what I talked about at the top of this presentation with home needs. So 23% identified chore service as a needed service, 18% with exercise programs, and 11% identified senior center activities. And the biggest unmet community needs identified 18% with affordable housing, and 28% said they don't know. So some insights to gather from this is high internet usage, fitness centers and senior center usage reflect a strong digital and community engagement, which is really ideal for outreach and really connecting to those older adults in the community. There is a need for chore services and exercise programs in this county. And then also affordable housing is a more pressing need than we identified in the overall sample. Again, not overly surprising. Education on available services is also needed to address the uncertainty that people were identifying with, knowing that they need something but not sure what they need. And then as far as access to benefits, 59% said they feel confident that they are receiving all eligible benefits. 20% said that they are not receiving benefits that they feel like they may qualify for, and 20% were just not sure. So some of these unused or potential benefits could be things like home energy weatherization, medication discounts, property tax relief, free cell phones. Basically, any assistance to older adults could be identified as a benefit that they might not be addressing. And you can see kind of the outline there of the potential ones that they feel like they might not be taking advantage of. So some insights is Washtenaw County older adults are financially better off than the overall sample with higher incomes and also less debt. However, benefit awareness gaps still persist in this county compared to the overall region. Some of these gaps, particularly in Social Security and medication discounts, those were higher than the rest of the region. So there could be some opportunity there for some targeted outreach to make sure that they are aware of those Social Security and medication discounts that they might be eligible for. And then for financial situation and debt, kind of pinpointed this a little bit on the first slide, higher income levels than the rest of our region, but there is still that 22% that make below that $31,175 a year. And 20% actually make $6,000 or less a year. So a really, really low income. 47% said they can pay their bills comfortably. 40% did say they have to be careful about their spending, and 13% said that they have trouble paying their bills. 54% said they have no personal debt, but 18%, like I mentioned, have that more than $10,000 in debt. So among those that have debts, 44% are not behind on payments, 17% are behind on those payments, are on credit card payments, and 11% are actually behind on medical bills. So some insights identified specifically for Washtenaw County. Again, I mentioned this, there's high engagement with technology, so 80%, 86% using internet, 59% using social media. So there's opportunity there to reach older adults at a higher level through those different avenues than maybe in some of our other regions. The older adults in Washtenaw also have strong social support, so many identified having friends, families, or confidants close by that they can count on. And there's a high level of neighborhood safety where 85% feel very safe where they're at. Some of the identified challenges, of course, mobility issues, so things like struggling walking or with stairs. Home maintenance, so like I mentioned, snow removal, lawn care are challenges in the county. Also, I just being aware of the benefits that they qualify for, unsure if they're missing different benefits that they are not taking advantage of that they could be. And then also financial strain. So there is still that 13% that have trouble paying bills and that 17% that are behind on credit card payments, even though in the overall county there are higher income levels than the rest of the region. So some possible recommendations could be things like expanding chore services and home modification, home safety modifications, which again, that is not new, of course. Speaking candidly as AAA, there's some hurdles that we have to jump through to be able to provide some of those services. So we often rely on community partners to be able to kind of fill those gaps. So that's very much in line with a lot of the rest of the region with the need for home safety modifications and some chore services like snow removal and lawn care. Improving transportation access so that we can make sure that older adults don't miss those medical appointments. Enhancing benefits education programs for things like medication discounts, free cell phones, Social Security discounts or benefits, etc. Also, there is a need for exercise programs and social activities, as there was a high need of older adults addressing the need for physical activity and feeling isolated. And then being that there's a larger portion of caregivers in this county compared to the others, obviously providing caregiver support groups or resources for those caregivers would be helpful in Washtenaw as well. So I'm going to stop sharing my screen and then I am happy to answer any questions. And I'm also happy to provide this as a follow-up. So, I know there's a lot of stuff in here. So happy to share that out as well. And we're also always happy if you have groups that you want us to speak to or want to share this information with other partners. We're always happy to do that as well.
Yeah, thank you. Brenda, I see your hand first, and can you say where you're calling in from?
Brenda McKinney calling from Superior Township. I just want to let everyone know that I'm here and I apologize for being late.
Thanks for
Thank
coming.
you. I noted that on the attendance.
Bruce.
Oh, thank you, Stephanie. It was really helpful and interesting. Couple basic questions. When was the survey actually conducted?
In July, I can pull up the exact dates, but it was in July of this past year. So just a few months ago.
So was there, of this past July,
Yeah.
was there any were there any questions at all? I know it's a little difficult, but were there any questions at all about um, concerns from all the stuff that's going on in Washington and how it was impacting people?
Not in this survey. So the survey was specifically just focused on, I mean, that could definitely be impacting. I mean, that's definitely, again, for things like benefits access, people could be, obviously we live in a world, so we're taking into account those things. But no, there wasn't any questions on that. It was specifically just looking at unmet needs.
And then just one other quick question. Affordability came up around the housing. Was there any other exploration around affordability and in more general terms around rising costs or preparations for, long-term care, future living concerns? Was there any probing of that at all?
There wasn't any question specifically on like rising costs or anything related to that or in preparation.
Okay, and the last thing I just want to mention, I have a doctor's appointment at 10, so I'm going to have to duck off, but I'll stick around as long as I can.
Great, thank you. Phyllis and then Margie.
Thanks, Stephanie. So as I'm listening to this, I'm wondering what we as a body can do, or or maybe the information of like some of the recommendations that you mentioned will then go to the Office on Aging when it starts. Certainly educating the public of potential benefits that are out there came to mind for me. And I think this is helpful to all the service agencies to know where the needs are, how they fit. So it sounds like it has a lot of potential for helping within the county. And I don't know, Bruce has mentioned this from time to time. What can we as a body do? So maybe we can keep that in the back of our minds.
Yeah, and this, I mean, again, thinking back to when we did this in 2019, we utilized the information, but really it was utilized the most out by community partners. So, like I even mentioned with, you know, lawn care and snow removal, that we have some limitations with what we're able to provide. So really, I mean, the goal is to have this out so that community partners can utilize this as well, and we can work together to try to address some of those unmet needs. So yeah, I mean, like I mentioned, happy to share this with whoever needs to see this to try to address some of those.
Margie and then Elizabeth.
Stephanie, thank you. You must do this, I guess it's 6 years since you've done the last one, right?
Yeah, the last one was in 2019.
Yeah.
We don't necessarily do them every 6 years. Like I mentioned, we do a multi-year plan every 3 years where we have to do some sorts of needs assessment, but they're often not as in-depth as this, just based off of what funding we have
Yeah.
available to do it.
Okay. Do you know, you have information about your sampling and about your response rate?
Yeah, yep. So I can pull some of that. So we had, yeah, I don't have it pulled up right now, but I can pull some of that. We had a little over 17,000 individuals. About half of those came through text surveys, and the other half were phone surveys. So they had individuals just calling.
Oh, so the response rate was?
They went until they were able to get a sample large enough to be able to extrapolate that out to the county. So I'm not sure how many people they ended up reaching out to, but once they were able to get to that design, I think 1,700 was what they needed to get to. So they basically went until they were able to get to that point.
Okay. And do we have, I guess, I'm not quite sure whether you asked this, but do we have any way to display the responses, just where the responses were in the county, like a map?
We've
Probably.
actually been asked that. So yeah, that's something that I'm going to ask
Yeah.
them to see if they have that. Because we didn't ask specific information on, where they're from. So I don't know if they are able to, if they completed it off of a text survey, if they're able to kind of pinpoint those. Because we really just asked them what county they were in. Obviously, we asked them questions like if they're, suburban, urban, rural.
Yeah.
But yeah, so I am not sure if we have that information, but
Okay. Okay. Thank you.
yeah.
Elizabeth and Bruce.
What really struck me is the number of folks who indicated they needed help in snow removal and mowing their lawn. And those are things we don't often talk a lot about providing services, but especially the snow removal is crucial to allow people to access those other transportation services to get in and out of their houses. And I just would like to maybe put a note in our minutes as we start thinking about things that the commission could do is raising that up as something to look at, ways to provide that, because it's relatively easy in terms versus providing in-home care and some of the other services. It's not time dependent. A person wouldn't need to be there at a certain place at a certain time to do it. So it sounds like that. And yet we have 20% of the people saying that they need help with that. So that was a particularly interesting thing to me because we have not, to my memory, really discussed that a lot as a commission as a way to help people live independently. And this really kind of showcases that. So maybe we can put a pin on that and come back to it later.
Agreed. Thanks, Elizabeth. Bruce?
Stephanie, was there any information relative to people's living arrangements? Whether they were in homes, whether they were in, I know there was some around whether they're living alone or with others, but do they own, do they rent? Are they in complexes? Are they in institutional settings or things like that?
I don't believe in this. It was just about living alone and whatnot. But I know through census data, they collect things like if they own or if they rent or if they're housing cost burdened and stuff like that. So there's definitely the data out there that we can get. But I'll double check. I'll go back to the actual data set and see, and I'll let you know.
And then one other follow-up on the caregiving slide. Were there questions asked about whether they were they were acting as caregivers themselves as well as whether they were receiving caregiving?
I can find that out for you. I don't believe that there was. I think it was because if you answer to one question, you kind of go to the rest of them. So I think the question was just if you're providing caregiving services to somebody else. So I don't believe we asked if they're also receiving, if
Yeah,
someone's taking care of them as well.
yeah, that would be particularly helpful to know, or whether they anticipate, it's hard to get a handle on, but things change quickly and how much people are prepared if they need caregiving help.
Yeah. I do think one of the things in Washtenaw County, kind of that I noted was that they, compared to the rest of the sample, had higher instances of, family, friends, confidants. So you could kind of read that as into, that combating with social isolation. Maybe they have better networks. So when they do need some care, there might be some of that a little bit more built in than in the rest of our region. But yeah, good point. I'll go double check to see if we asked that, but I don't believe we did.
Thank you.
Yeah.
Linda?
Yes, Stephanie, the way the survey was conducted, there was no way to find out how many older adults in the county are homeless, right?
So we didn't have any questions on that. How it was conducted was it was through phones. So if someone didn't have access to a phone or a phone number that the survey company could reach, then yeah, we wouldn't be able to reach them. So yeah, there wasn't any questions specific to that, but there is some, point in time data that can be gathered from census and whatnot.
Yeah, I was going to add that your
that
local
are that
community
are
action
homeless,
agency.
right, in our county. So we don't have that information.
Not through this survey, but the information is out there.
Oh, okay.
Just
No.
not through this survey. But yeah,
Okay.
they do point in time, where, they'll go out and count and so that data does exist.
Okay. Thank you.
Brenda, I would recommend reaching out to your local community action agency. They are probably the ones who spearheaded the point in time count. That usually takes place the last day of January. Although I know some counties this year also opted to do their own point in time count in the summer,
Mhm. Yeah.
just to see the differences there. So that's who I would look to get that information.
Thank you.
Brenda, I
local.
can,
Go
sorry, go
ahead.
ahead.
No, you go ahead,
For
Madden.
sure. Okay. I was just saying, Brenda, I can share all that information with you. I'm on our action agency, and then Housing
Okay.
Bureau for Seniors also has a one pager that pretty much just asks or answers everything Bruce and you just said. Which there are 35.36% of unhoused people that are 55 and up in our county.
Really?
Yeah, I know.
That's a large number.
It is. Marie, did you want to say something before I ask a question?
Nope, I was going to point to you, so
Perfect.
you jumped in. Great.
Lovely. Okay. What would you say like were the limitations with the survey? You mentioned the phone, which I hear that, and that's a big limitation because that's most of my people would not be able to complete that. But can you talk more about what those limitations are and what communities we might not have heard from?
Yeah. So the survey did try, to make up the demographic makeup of our region. So, X percentage, minority population, but like things like, especially maybe not as much in Washtenaw, but like the rest of our region with like Macomb, we have a very large limited English speaking population. That's of course a limitation as well. They did have the survey, I believe you could take it in Spanish, maybe one of the, but again, that's a strong limitation. And certain individuals are going to be the ones that are completing surveys on phones. Certain individuals are going to be the ones spending 15 minutes on the phone completing a phone survey. So like that's always going to be a limitation, is that's maybe a specific type of person. But did try to at least get the demographic makeup as close as possible. Yeah, that would be the biggest one.
I would say another limitation to the survey would be capturing older adults at various stages of cognitive ability. So, of course, those that are taking the survey are going to be like our most cognitively aware adults. Um, they're going to be those adults that are most likely to be able to answer their phone when it rings or, respond to a text message or something like that. So, I think that's a little bit trickier because to get that information, you're often having to get it from the perspective of the caregiver. And that's not who this survey was targeting. So,
Yeah, exactly.
One other question was, did they mention where they turn to for information most frequently to get help?
Yes, that we do have that question. I can pull it for you. It was asked things like the internet, their doctor's office, friends and family, those types of things. So yeah, we do. I know we do have that information. I can let me see if I can
yeah, I
pull
think
it
we
for
could
you.
pull a simple,
Yeah.
we could put together a document that just shows the questions that were asked. I think
Yeah.
what we have also has like all of the regional like data on it, but we can provide a simplified version that just shows everything that was asked.
Did they go into specific organizations by chance?
No. It didn't say like it didn't ask specific names. It just that was an option, of community organizations, but it didn't go into specific ones.
Thank you.
Yeah.
Yeah.
I just want to comment and say that I'm really surprised that they were able to get any information with a phone survey from older adults because we have been encouraged not to give out any personal information, and I don't tell them anything on the phone anymore. So I
Yeah,
kudos to you for getting information over the phone these days.
Yeah, when we were setting it up, because in 2019 it was just, just a physical phone survey, and they had suggested us trying texting links as well. Because again, I mean, 60 and over, a lot of older adults are texting, utilizing technology. So we had tried with the texting at first, and then once they hit a certain point, they were going to move to phone surveys. And I was very, we put something on our website. We made sure that. So they could go to our website and say, hey, yes, AgeWays is conducting a survey, so this is actually real. I made sure that on this, I basically tried to put stuff as many places as possible so they can confirm.
Yep.
So I was also surprised at how many just text surveys people completed. But I say that as someone who I complete text surveys, but of course I'm not, but I complete all the text surveys. So
If
there are
they
people
call
out there.
Stephanie, if they called me, I probably said, "Give me your number and I'll call you back."
Exactly. Yeah, yeah.
Right.
Yeah, so I tried to do a lot of those things. I was getting calls from people asking if it was real. So, I was surprised
Uh-huh.
too.
Mhm.
Great. I had a couple of questions. A lot of mine were already answered or commented on, though. For the caregiver slide, there was caregivers cited other needs at 57%. Did they have the opportunity to say what that other meant to them?
I'm gonna check and see because I believe so, but because I noticed that too when I was going through that slide.
Yeah. Um, And I believe last time when you presented on the 2019 survey, you were able to show on some of these the difference between, or like at least the breakdown with income. So let's say 57% of caregivers cited other. Um, in rural, this was what that other meant, and in urban areas, this is what other meant. That would be really interesting to see um,
Okay, I'll
as
see if
well.
I'm not sure if we have the urban rural city breakdown for caregivers. I know we have it for older adults,
I just meant,
but I'll
yeah,
double check.
broadly over whatever data points you can. I'd be really interested to see if some of these needs are consistent between the urban and rural, or if some are elevated a little bit more, you know?
Yeah.
Yeah. The caregiver thing was just an example, but
Okay, got
yeah,
it. Yeah,
more
I
broadly.
can pull.
Um, and you probably don't have zip codes, right?
I'm
Yeah.
double checking with that, but I don't believe I know at least in the survey we didn't ask any identifying information on like what area. It was just what county they're in. So yeah, I'm gonna see if it's possible to get sent again since they use phones if they mapped that at all.
Mhm.
So we'll see.
Cool. Thank you. That's all I have. Allison?
So what I was really interested in the income stuff as well, and comparing that from 2019 to now to seeing the poverty rates, because earlier this month a new poverty report came out, like just like a couple of weeks ago, and senior poverty went from 9% to 15% in some areas. And then
Really?
controlling for it, we're seeing it go up more significantly. So if we're seeing costs for medical going up, costs for housing, which is really affordability, it'd be interesting to see the comparison of where people's incomes are. And I even see the data that we have here for those who completed it. There's some pretty high income rates. And being from IPSI, I know a lot of seniors that's nowhere near what their income level is. So I think those are things to take into consideration because there's even projections that poverty could go up another 1 to 3% just this year alone for seniors.
Yeah.
Brenda?
And why do you think that is? So the change in the income, is it uh, work or what is it? What do you think it is?
The report didn't go, I didn't read the full report yet. I read like the executive summary. There's like a 250 page report.
Mm.
Um, and then the Southern Poverty Law group is doing some analysis too right now, and they hope to have some information by the end of the year. But I would say it's, in a lot of regions, right? We live in the Midwest, and
Mhm.
housing prices are just going up, 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 and
Okay.
rent prices are going up, up, up. That
Okay.
is the biggest concern. And when you still see the unmet need that I saw there, which was
Hmm.
some of them not knowing that they could even get support for paying their property taxes, that's going to be
Hmm.
huge for keeping our older adults in their homes. So,
Hmm.
like when Housing Bureau talked about the housing fund. That was maybe a discussion for this group. Maybe that's
Right.
where we can throw our support in as a group and saying that this, that's a big deal to keep people housed and it costs a lot of
Mhm.
money. But if we have this fund, maybe that could be really helpful. So we're
Mhm.
preparing for what we know is happening with increasing poverty levels for seniors on
Mhm.
limited incomes.
Okay, that
And I
makes sense. That makes sense.
guess too that as to why the poverty number in general has just increased, right? Because that's looking at what income people actually have not coming in. Threshold doesn't look at your income versus expenses, just looks at your income. I would venture to guess that a lot of it is because the aging population in the country has increased, right? So we've got a lot more people that are turning 55, 60, 62. We
Mhm.
have a lot more immigrants that are aging into our community, and they
Mhm.
might not necessarily have access to the same type of Social Security benefits. They
Right.
might be only on
Right.
SSI. And we've
Right.
also got, we also have fewer and fewer people who have access to a pension fund. So those
Okay.
would be my guesses as to why the poverty level is increasing.
Mhm. Hmm.
Great. Bruce, I know you have to leave soon, so we'll go to you and then Elizabeth.
Yeah, I was just going to say one quick thing about the reporting in the subcommittees. The subcommittee that of looking into the future is still on hold, but we're hoping to have something uh, soon. It's just been very complicated to get anything with so much still unfolding. So, but I also wanted to mention just a comment on the poverty. Um, Having done a fair amount of work in poverty, I think the issue of near poverty is also critical. I know the Alice work takes that into account, but there's a lot of people who are, just above the threshold, but there's so many people who are in near poverty or just in a lot of the national studies have indicated, people's savings and resources for long-term aging is just nowhere near where they need to be. So I just mentioned that as the poverty is one measure, and I know there's a lot of limits to that, but I think it's also really important for us to keep our eye on the near poverty population.
Mhm. That
Thank,
makes sense.
yeah. Thanks, everybody. I'll see you soon.
See you
Take
later,
care,
Bruce.
Bruce.
Bye-bye.
Elizabeth, you're muted.
There we go. Several people have mentioned some interesting data sources like the CAN data and the poverty level data that has come out. So I was wondering what the best way as we each come across something interesting is to share it with other folks. Should we send a link to you, Marie, or send it directly to Katie to send out? I don't know what the group would like, but I think it would be great for those of us who want to delve into a particular issue
Hmm.
to have those easily available.
That makes sense. Hmm.
Yeah, I would recommend sending them to me and Katie, so having both of us on there. And what I've been having Katie do is hold on to uh, links, attachments, um, event invitations, other communications that we get, and then send them to you all at once when we're getting ready for this meeting. That way, you're not getting all the stuff all the time. You're getting kind of everything at once. I think it's a great
Hmm.
idea. Allison?
I have to pop off the call just for a few minutes because I have to do an interview and then I'll be back in.
Okay, sounds
All right.
great. Anyone else? Questions, comments for Stephanie? Thank you so much, Stephanie. I love these surveys and the data updates. They're so helpful. And I would also love to see when you have that comparison data from 2019 to now. I'd love to see how things changed, especially with that COVID stuff in the middle and all the recent stuff this year. Um, yeah,
Yeah.
yeah, I'm really excited to see that. Thank
Yeah, I
you.
am too. I'm excited to get that done. But yeah, again, I'll share all of the stuff and I'll share the executive report too that really outlines like all of the data points so everyone can look at that.
Awesome.
Thank you,
Thank
Stephanie.
you.
All right. I'm gonna pull my agenda back up. So next up is our subcommittee discussions and updates. First up is communications, and we did receive two communications this month. The first, Ashley forwarded to all of you. Jim from the Dementia Friendly Services, previously Dementia Friendly Celine, has a event that they are inviting all of us to. So check out those details in your email. If you can't find it, let me know and we'll have Katie send that out as well. And then the second one was Senior Living Week. And so I'll turn that over to Madden to say a little bit more about that.
Awesome. So, has anyone attended Senior Living Week before? Because you guys know I'm new, so you guys are the ones who've been here. Okay. Yep, we've got some people. So it's an annual event that Housing Bureau for Seniors kind of leads. We have so many partners that make it happen. We have the actual expo, which is October 11th, and that
Mhm.
is when all the vendors come to the Morris Lawrence Center,
Okay, yeah.
and there's probably like 50 vendors. So it's a lot, and they're all senior vendors. And so
Hmm.
you can kind of walk through and talk to staff, and it's not just like random people, it's really like the people who work in those organizations. So it's a really cool opportunity for us to go and talk to those people. And then, so the expo is really fun. We also have a speaker, and our speaker is a comedian. And what is her topic? Let me see. It's on my paper here. I have to pull up the email because I forgot. Um, do we know it? Okay, you guys, you'll have to, I can't say, it'll take me too long to find. Um, but she does the speak during the expo. So if you come to the expo, you can see the speaker. It's all free. You
Hmm.
don't have to register, but you can.
Hmm.
Um, and so another thing you'll want to look at is after Saturday, we have 2 weeks of workshops. And the workshops are all around senior services. So there's workshops about HIV and AIDS. There's a fun workshop that now that Bruce is gone, but he would have liked this one, talking about the big beautiful bill and how it's going to impact some senior services and things. Um,
Hmm.
just a lot of different ones, and they're all over the county in Ypsi, Dexter, Chelsea. And we also have open houses for senior
Hmm.
centers and things like that, all throughout that week. So there's a lot going on. You'll have to find my email to really look at everything. But it's a really fun time, and I learn things. Oh, there's health screenings, there's free vaccines,
Hmm.
COVID.
Hmm.
There's a pill drop box. So even if you just want to drop by, um, yeah, there's a lot of things.
All
Questions?
this is
Yeah.
drop
Yeah.
in, right? Like people don't have to
Yes,
register ahead of time. You just come
you
on
don't.
whatever days you want to come.
Yes, yes.
I have that on my calendar. Is
Good.
that on the 11th?
It is, yeah. So
Okay.
next Saturday. Yeah, this upcoming
Okay.
or not upcoming. Nope.
I plan on attending that. It sounds
Yay.
real exciting. And I like the comedian part because we could use some humor right now.
Yes, she's awesome.
Yeah.
I'm excited for her.
All right. Good.
Phyllis, I see you have a question.
Yeah, just a couple little things. Do you have any idea when that speaker would be speaking?
Yes, yes. I'm pretty sure. Yeah, she's set to let me just pull it up for you, Phyllis.
It starts at 9 a.m., right?
Does it? 9:30.
9:30. Okay.
Okay, let's see, you guys. Okay.
Someone sent us that information too.
Yeah, yeah.
Mm.
They did.
I didn't see the time
For
for
the speaker,
the
yeah.
speaker.
And what is the speaker's name?
Her name is Marianne Alda. You know what? I'm not seeing, it doesn't have a time on our website. Let me ask Yvonne and see if she can give us some intel.
Are they gonna have refreshments?
Sadly, no,
Oh, okay.
but our lovely
Mhm.
vendors do like to bring candy. The
Okay.
workshops, though, sometimes do. And I tell you what, those open houses, yeah,
Okay.
because they're fancy. But
The other question is, this pill drop box, is that at the expo
it
or,
is.
oh, okay.
Yep, 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 yep.
Sounds like it's well put together.
Mhm.
Mhm.
Yeah,
They
Housing
do
Bureau
a
for
lot.
Seniors has been doing this for a very long time. They know how to run this
Yeah.
thing and the right stuff to have. If you haven't checked it out, I encourage you to do so too.
Mhm.
Love to
If
see you all.
any of you have follow-up, more questions about that event, you can email Madden directly. We'll move on for right now. Bruce was saying the future planning and millage work groups, you didn't have a chance to meet, no other updates,
Right.
correct? Okay, great.
That's
How about town hall? Do you guys have any updates?
no, and what we're gonna do is so much happening around Medicaid right now, so many changes, and so many people are involved until like we're just gonna put that on hold until things are finalized,
Gotcha.
especially since the budget isn't going to pass now, or we don't know what's happening. It's just so much, just crazy right now. So that's going to be on hold for a minute until things settle down.
Makes sense. Thank you.
Hmm.
All right, so we'll move on to the report from the Board of Commissioners. Annie, any information you want to share? I see you're unmuted, but we can't hear you.
Okay, can you hear me now?
Yes.
Hmm.
Yeah.
You know, for a millennial, I'm really bad at technology. I have new earbuds and I've been trying to use them and it's just not working. So at our last board meeting, well, our last two board meetings, I've made sure during well, not our most recent, but the two before that, I made sure during my commissioner like liaison reports that I just expressed my disappointment with the lack of pushing resources out quickly. So I'll continue to do that. Justin Hodge and I have talked about working on something to try to push more money out sooner, like just bringing something to the floor. Without it going through like the process that gets all like approval from board leadership and just like moving it through.
Mm-hmm.
Um, because we have that as an option as long as we can get enough people on board. So we're trying to keep something like in the back pocket. Obviously, I don't know if I heard there was mention of this. So they did at like 4:30 in the morning finalize the state budget.
Mm.
I still haven't unpacked all of that, but I think that from my conversations with aging providers across southeastern Michigan, um, the like at least the nutrition sector of aging services is really struggling. And so, I think where we all probably hoped that the millage was going to help expand.
Mhm.
I foresee a lot of filling in gaps right now because of the high
Mhm.
cost of food.
Mm.
So just
Yeah.
trying to be mindful of the fact that we don't want to like cut off and we want to be able to expand.
Mm.
So yeah, I wish I had more updates though. I'm going to continue to be annoying about it though. I think it's honestly a huge disservice to the community that we are sitting on millions of dollars.
Mm-hmm.
Mhm.
Yep, let us know if you need help with any of that.
I appreciate it. Thank you.
Yeah, yeah.
Thank you very much, Annie, for all the work that you're doing.
You are very welcome. I wish I had a magic wand and I could just make people do things.
Mhm. I see Janan and then Elizabeth.
Yes, thank you. Annie, do you have an idea if there is like maybe after the new year or some timeline where opportunities for applying for funding for the senior millage could be available?
Well, what I've heard is that after we hire the new director, we'll be working on the RFP and it'll be ready in January. I have no idea what the like reality of that's going to look like. Um, I'm hoping that once we do hire a director, they can make some recommendations to the board, and I hope that recommendation is to try to get money out quickly. So as soon as I know anything about the RFP, I will share it with you all. Um, I mean, I'm also of the belief that right now, like we could push a bunch of money out without going through an RFP process.
Elizabeth, then Brenda.
Um, just to echo what Marie said, if we can be of any help, I don't know if a letter or resolution from us would help or hinder the process of getting money out, but um, maybe our chair could look into that, and if it would be helpful, let us know.
Yeah, I can what I can do is keep Marie in the loop. I know Commissioner Hodge, he was kind of taking the lead on a potential like path with like Meals on Wheels, like meal delivery service.
Yeah.
I kind of told Justin that I didn't have the capacity to really take the lead on that. And so I'm kind of letting him take the lead. But once I have anything to share, I'll share with Marie and then we can figure out like if we want to do some sort of like strategic like public comment or anything.
Mm-hmm. Yep. Brenda, then Madden.
Yes, Annie, how close are we to hiring a director? And do you think once we hire a director, it would help us get the money out faster?
So the first part of your question, Jennifer Green mentioned earlier that they are still in the interview process. I'm not on that committee, and so I'm really kind of far removed from where those conversations are going. So I know not yet. I think the
Okay.
plan was to try to have somebody hired at least by the end of October, but it's hard to know
Right.
without, you know,
I
and Jennifer
understand.
might have more to share. I think you got on the call late after someone else asked about that.
Okay, I understand. Okay, thank you.
You're welcome.
Yeah, Jennifer's having internet issues. She says she's trying to get back on, and you can bring your question to her again if you would like when she gets back. Madden?
Thank you, Annie. And going off of what you said, Elizabeth, I will say I've mentioned our skip funds here before in the direct impact they do have, and so those are coming to an end. We're at the last of about 10,000, and so maybe this group would consider like recommending that they put more money in the senior crisis intervention program.
Yeah,
Um,
hey, Matt, and I have a question about that.
yes, please.
Like, so can you help me understand, like in the past, and I feel like I don't know enough about this, so I'm gonna probably sound a little uneducated, but I think in the past, like Skip was kind of closed off and only like a certain number of like providers were making the decisions on like releasing Skip funding. But then when we put the extra funds up a couple months ago, we opened it up broader. Do you have any thoughts on that? Like, do you think that's been helpful
Mhm.
or
So
um
yeah, thank you so much for the question, Annie. I think that it's hard on us as skip members, and I think there's probably about 5 or 6 agencies right now that, you know, it's an everyday thing, the skip funding. And so it makes our job harder to open it up to the broader Barrier Busters network, but it's the only thing that feels right because some people don't know about our niche, not really niche agencies, but just like if Hawk hears about them and we don't, and we may never hear about them, it feels unfair to sit on this money and they don't even know, even though we send
right.
out monthly
No,
emails.
yeah. Okay.
So,
So maybe,
yeah,
and I don't know if this is something you'd be willing to do, or maybe you can work on with the subcommittee,
yeah,
on the millage, but it would be really cool to get people who are kind of experts in this area to make a recommendation
okay,
to us, and maybe we pass a resolution, both
yeah,
on like what we think is the appropriate amount of money annually to invest in Skip. Like,
right,
is because we just allocated 100,000
right.
recently.
Yeah.
What's the right number? Is
Yeah.
it 400,000? Is it
Yeah.
100,000 a quarter? I'm just curious. And then if you have any recommendations on how we can make the process better,
Yeah.
I would also be curious to know that because to me, like I have no idea what it's like,
Yeah.
what you all are doing on the back end. But as a commissioner, I would like to not just throw a bunch of money at a program and create
Right.
chaos for the people who are administering it. I want to know that it's like it's effective for the people who we're trying to help and for the people who are responsible for actually making sure that we're getting the dollars out, if that makes sense.
That does make sense, and I appreciate those specific like pieces where I could help you understand that process better and everybody
Yeah,
else.
awesome.
I think so an idea I've been sitting on for a little while for the Office of Aging Services is when that director is in place to launch like a letter of intent or an RFQ, request for quotes, or something like that to get that kind of information
Hmm.
across the aging services
Hmm.
sector. Because even what we saw with transportation, the county doesn't know what transportation costs and what all the needs are. And that's okay that they don't know that. But in order to get some of that information from transportation, from housing, skip, and stuff like that, I think that that would be a good directive for that entity when they get started. Elizabeth?
Just to echo that request, Annie, for specific information, anything that could be provided about what skip funds went to, how many people they helped, kind of specifically the kinds of things that it paid for. I think one of the things the millage subcommittee has heard all along is that people want to know where the money is going.
Hmm.
And I think we sometimes forget that that information is important for the county
Yeah.
commissioners to have as well.
Hey, yeah, and I don't want to put anybody on the spot and at all, but I'm wondering if it makes sense to get like a mini update on Skip at one of our board meetings, like a quick little like 5-10 minute presentation where we could make the rest of the board aware of like where how quickly the amount we allocated went down and just like how impactful it's been. I don't know if it would be like some folks in the Commission on Aging, like maybe Madden, without, putting any pressure on anybody. It's just an idea of something that like I think or I could do it during my commission report. I could actually submit like, try to get some numbers and do it that way. But I'm just kind of wondering if like instead of doing like a big annual report, like we always get those, but I wonder if
Mhm.
just giving the commissioners kind of an update really focus on Skip because part of
Mhm.
the problem is we have so much information thrown at us all the time. It's
Right.
confusing and like I'm a nerd about this stuff. Not everybody on the board like not everybody on the board like kind of like breaks it all down on
Mm.
like what happens once we allocate the money. And I think that might be helpful for the rest of the board to know.
And I think we can show the board like the dire need. So
Hmm.
we are wanting to communicate with the board on
Yeah,
like,
and plus,
yeah,
like, and maybe, sorry, I feel like I'm going off today,
no,
but like, we identified the main areas of focus in the framework, and one of those areas was reducing, eliminating, homelessness. And so I feel like maybe like that's an opportunity to like kind of show how this is doing that and how
yeah,
we need to do more of that to really get to the full like prevention and like I don't know, I know how Hawk works. I know that there's limits on how often you can use Hawk. The point that I keep trying to make people is an individual might need to use assistance more than once. And
right.
how do we figure out like is it $200 a month that they're short on and that's what's causing them to be near eviction? Are they like skipping their medication to pay for their rent?
Right.
Um and so
Right.
anyway, that's like a longer
Mhm.
conversation. If anybody wants to like get coffee and talk about that, I'm open.
Mhm.
Always down for that. Yeah, I really like that, especially going into the winter months. Right now, we're still a little bit ahead of it, and it takes a little bit of time for movement to happen with the county. So I think doing that sooner rather than later would be prudent. Um, So yeah, Matt, and maybe you and I should talk about what that could look like, and then we can pass it to Annie.
Yes,
Yeah,
absolutely. Thank you, Annie,
great.
and thank you, Marie.
Margie?
Yeah, so I just think I really support that. I think giving people feedback, there just isn't anything better about the effectiveness or lack thereof of the programs they have or the work they've done. What if we had kind of a every other meeting just have a friend of mine used to say, be bright, uh, um, be brief, be gone. And just kind of just, 3 minutes of some kind of report back that we did that would tell them that the needs are either met or they're not. And end with something like, people are still hungry in Washtenaw County. And make it kind of a every other meeting, just, I don't know, Annie, whether this is reasonable, but just a brief feedback that would maybe cause them to move in one direction or another.
Yeah. Yeah, I think my experience is that if you keep something to like 5 to 10 minutes, it's a lot more impactful. So I think that I can share it underneath my like commission liaison report, or maybe once a month we can try to get somebody from the Commission on Aging on
Yeah.
like a 5 to 10 minute slot, or we could ask the county administrator to add it to his updates. Or we could ask once the new aging director is on to make that part of their, like we could add them to the agenda and get regular updates from them as we roll everything out. So yeah, I'm open to all like possibilities, but I think the more information, the better. But in like small increments, just because people have their attention spans.
Yeah. Yeah. If we could just make
And
a kind of routine, I don't know
yeah, and
who should do it.
one thing I'll say too, like if you guys have anything that you want me to share at our board meetings, like during my liaison report, like something's very specific, just send it to me. You can either text me or email me, because sometimes like by the time we get to our board meeting and by the time we get to liaison reports, my brain is already all over the place depending on how much public comment we've had. And so sometimes I have a hard time with like, and I need to start writing some of this stuff down prior to our meeting. That way I don't lose track of what I wanted to update on. But if you ever have things that you want me to make sure to highlight at our meetings, just let me know.
Okay. Okay.
Great. Anything else from the Board of Commissioners or any other questions for Annie? Wonderful. Thank you, Annie.
You're welcome.
Next up is report from the chair, and I don't have anything additional to report. New business. Anyone has new business or last minute questions, discussion? Madden,
I
I saw
just
you on mute.
have, yeah, a brief little announcement, and you guys also know about this because it was here before I was here, but the home share program is back. Are you
Yeah.
guys familiar with that? Yes, yes. So home share is, and I will absolutely share the flyers and all the information with you all because you can help connect people in your community. So shared housing is a long-term living arrangement where people share a home, each with their own private space and shared common areas. So there's a homeowner and there's a home seeker. So the homeowner is the person who owns the home and is seeking like a roommate to rent their private room at least for like a year. And they offer each other companionship and just like mutual chores and taking some of the load off of living all alone.
Okay.
So the criteria is that one person, whether you're the seeker or the homeowner, does have to be 55 and up. So it is like a senior specific service. You must live in the Washtenaw County and keep in mind that you do need to pass reference and background check. So if you
Mm-hmm.
do have friends with a colorful background, maybe that's not the best fit.
Mm-hmm.
Um, Depending on like the crimes. So let me see, what am I missing? So yeah, it's yeah, actually I think that's everything. Any
Right.
questions
Yeah.
about it, guys? Yeah,
We're
go ahead.
very excited to see that relaunch. It used to be a Housing Bureau for Seniors program, and they were not able to restart it post-COVID. The Healthy Aging Collaborative that Dina and I were on at the time, we were able to work with Housing Bureau for Seniors, the Washtenaw Housing Alliance, which is the one agency running the program now, to get that up and running. And it's just so exciting to be announcing to the public that it's running. Thank you, Madden.
It is very exciting.
Anyone else?
Oh,
Margie?
well, something really quick. I don't know whether you all are familiar with the University of Michigan National Poll on Healthy Aging. They they're kind of in the most recent one was on loneliness and isolation. And they have some really great reports. They will speak. I think their surveys are extremely well done. And there is a lot out now on loneliness and isolation, partly because Murphy, as the Surgeon General, really put forth that concept as an epidemic. And so I just encourage you to look at that site because there are many, many reports and they're all extremely well done. We might have someone come and talk to us about their work at some point.
Can you send that to us, Margie? I would be interested.
Pardon?
Can you send that out? I would be interested.
Yeah, you just look up. How about I put it on do we have a chat?
We don't, but Katie and I
Oh,
can pull that link for the Michigan
okay.
National Poll for
National
Healthy
poll.
Aging. I look at those
Yeah.
as those reports come out too. Yeah.
That would be nice. Thank you, Margie.
Mm-hmm.
Yeah, I'm thinking as a supplement to the emails with the agendas and minutes, maybe we just have a document that is like a rolling updated document of
Like
various
that.
data sources. Yeah.
Yeah. Thanks, Katie. Anyone else? New business? Final questions? Comments? All right. Our next meeting is November 7th. Do we have a motion to adjourn at 10:27?
So moved.
I
Support.
saw Elizabeth. I heard support from Brenda. All in favor, you can do a thumbs up.
Thumbs up.
Great. Thank you, everyone. Have a great weekend. Enjoy this unusual heat.
Yeah. Thanks, Marie.
Yeah, thank you.